Welcome back, everyone, to another PT Pearl from the Optimal Body Podcast. I'm Dr. Dom.
I'm Doc Jen.
And we're coming to you from Dallas with this beautiful background to talk about the core and back pain. And why do I feel back pain when I do core exercises? Does doing core exercises help my back pain? I don't know. We're going to talk about it right now.
Do core exercises help my back pain? Or why might I feel back pain more when I do core exercises?
Your face. Everyone just needs to see your face that you just made.
I'm just getting into it, okay?
I feel it.
It's like the front of my first carousel.
Very dramatic.
You got to get into character. I mean, where did this myth come from? And I'm going to say myth because we're going to debunk some of the things that you've been told maybe about why, back hurts, do core exercises. Like, what the heck does core exercises even mean? Like, what is the core?
The six pack.
Oh, okay.
I think that's what a lot of people think. Oh, when I do core, I need to do more sit-ups or I need to do...
Yeah.
And we've talked about this a ton. So if you're a regular listener, you know that that is not what the core is. The core goes first all the way from almost our neck down to our pelvis, down to our pelvic floor. And if we're talking about just that core canister, I like to view it as a little pop can where the top is your diaphragm that you breathe with, your respiratory diaphragm. The bottom is your pelvic floor, your pelvic diaphragm. And then we have this amazing compilation kind of all these muscles that go around the core. Our transverse abdominis being the big core set that almost acts like the sides. But then
the deepest layer.
The deepest layer, and then so many other muscles that kind of layer on top of that make up this core, including our back muscles.
Yeah, so people talk about those four being like the deepest core muscles, which we're going to talk about as well, but like that diaphragm, pelvic floor, transverse, and multifidi, like that kind of makes up that inner canister thing. But then we also have the outer core, which does include the six-pack muscle then, right?
Yeah.
That is your rectus abdominis. But then we also have our obliques that kind of come into play as well. And then we also have our bigger back muscles, our rector spinae that come into play. And then we also have
the QL.
We also have all the way up to the shoulder blades. So the way that you control your scapular muscles around your shoulder blades plays a role.
Intercostal muscles that basically help our ribs expand and depress with every breath.
And then if we go around the pelvis, like, yes, we talked about pelvic floor being the inner, but then around the pelvis, that helps to control the hips as well, is going to be our glutes. So it's like all of that actually is your core.
Totally. And that kind of points out one of the challenges in a lot of research that try to just associate weak core means back pain.
Yeah.
Because one, back pain is not specific at all.
No.
There's a whole category of back pain disorders that we just call non-specific low back pain. Like you'll see that a PT or a doctor writing that down. It's just non-specific low back pain. And what we just went through, there's so many different core muscles that we could be measuring. Well, is this one weak? Is this one weak? Are they all firing in concert like they should be? Like
basically, we're saying that low back pain it can't be correlated to one specific origin. We can't say like, oh, you have back pain, you need to work on your core. That is an old theory that has been preached for a really long time. So it's ingrained a little bit in our brains, right? And that's what we think, that's what we know. But what we know to be true now is that one, the core means a lot of different things. It's not just stabilization and making you like only train in one position, right? And we also know that there's a lot of different reasons why you could be having back pain, and it could have nothing to do with muscles or body position or posture. There's just no way that we can dilute back pain down to a single thing. The reason why you might feel better with going to a PT and doing core exercises is one, you have that expectation already like in your mind. If I get core exercises from my PT, my back pain's going to get better. So your expectation of going in, like it might meet your expectation, which already gives you a positive outcome in terms of how you think you're going to feel. Maybe you have a good like relationship with your physical therapist, good rapport, or used some tool or modality on you that helped to relieve pain right away. And you got this neuro response that like decrease those symptoms. And so automatically you're like, oh, this is working for me.
Yeah, that belief is literally seen as one of the highest correlations to people actually getting better when they see a PT or a chiro or a provider. If you go in with the belief that it's going to help you, often your mind is so powerful that it's going to really influence you in that direction of feeling better. And I don't think that's a bad thing for providers, for PTs, for people to take advantage of. I do think that provider then has a responsibility to help empower them to maintain that throughout life moving forward once they stop seeing the PT, because that's also a tool that providers will use to gain reliance from, patients or clients on them and say, okay, well, when this comes back, you just come back and see me. Well, if we don't change the way that we were operating and living in life, likely we might go back and do that same thing that landed us in this situation in the first place.
Right, exactly. And so was it, your relationship with your physical therapist? Was it the core exercises itself that helped the back pain? Was it just that you did something different than you were doing before, which created a different result?
And I think people who are into the strength training side of things will love to hear this, but there's very, very good evidence that when you get people into a full body strength training program, a lot of that non-specific low back pain will go away. The thing that we also get with strength training is just this broad amount of other physiologic benefits, both mentally, because you take somebody who has low back pain and you start getting them to deadlift weight off the ground and feel better doing it, man, that's going to spark something inside them to say, oh my gosh, I can bend down and pick something heavy up off the ground and feel okay doing it.
It's not just that physical response that's happening. And you might have noticed this, like if you go and you all of a sudden start to lift a little bit heavier, or you've taken a break off strength training and then you come back, the thing that might fatigue, you might feel a little like shaky and you're like, I haven't even done many reps or I haven't done much stuff. Well, we're putting a positive stress on that nervous system. So now it's going to be able to respond to other symptoms and stressors that we might get, which is pain related, stress related, a lot of other things. So that's where strength training and putting on more load onto your body can have that positive, good benefit of how your body adapts to stress on its own. When you did put it with core exercises, more specific core exercises, right? We did see actually better long-term benefits in chronic low back pain or changes in how you respond to that.
Again, deep core training can mean any of like 100 different things. Breathing and just learning how to get some of that stabilization to segmental, core activation where you might be doing some different moving. You might be doing even like a cat camel or a cat cow to learn how to kind of segmentally move different areas of your back and do that through core stabilization. You might even move into some dynamic deep core stabilization where there is more movement of body parts, or you get standing and then you're working on core stabilization.
And so that's going into like the 4 different types of core that we can talk about, right? Even if we talk about just like standing on a single leg, closing your eyes maybe, your body is now having to recruit a lot more muscle activation than you might be used to. And so all of a sudden that is challenging the core in a way as well. So balance, not just laying on your back, but sitting up, moving on a Swiss ball or a physio ball. Like what responses do you get within your deeper core musculature from your entire trunk, right? That balance, that stability. So being able to do a bird dog without moving your trunk, being able to only move the limbs, doing a dead bug without moving the pelvis at all. So that's that stability. And then we also have that motor control. So does your deep transverse abdominis kick on before your hip flexors, right? And that's what a lot of people feel. They might do like a dead bug or some core exercises and their hip flexors are the first thing to pop on. So, well, we're not working on that motor control then. And then that last one being that dynamic movement kind of stability. So it's like your core is not just sit-ups. Your core is not just laying on your back doing Pilates type exercises, which I was the Pilates instructor. Believe me, love my Pilates type supine exercises. However, we go across the board even in Pilates of what that means using the core. Again, like, where am I moving from? How can I create that movement to be more effective throughout the entirety of all of those segments? It's having that control. It's having that movement and freedom and flow from rotation, flexion, and extension. And then being able to also stabilize and control just, with only moving my limbs and not moving in my trunk at all. I mean, there's just so much that we can say here about what the core is. And I think what ultimately, we've talked about so many times as well is, well, then why might I get back pain? And why, if it's not just my core that I need to strengthen, where could that back pain be coming from?
A lot of research and just a lot of education on this is starting to steer into what we call this biopsychosocial model, where bio meaning body and the physiology going on there, psycho, of course, kind of talking about more our mental, emotional status, on the spectrums of depressive or anxieties or just stress in general, and how that impacts the way we feel pain. And then also the social aspect, which, I talked about fear avoidance with lifting stuff off the ground. It's shown that the more that we have fear, the higher levels of pain we might have when we get into certain positions, rather than empowering ourselves to bend down and pick something up from the ground without fear or free of fear, which is tough to get to at some times. And then the social aspect, maybe now bending down and picking stuff off the ground allows you to return to work or return to being a grandparent who can lift their grandkids off the ground.
Again, we can't just say, do core exercises, change your posture, get strong. All of those play a role. Yeah. And take a look at your stressors. Take a look at what you're putting in your body. Take a look at who you have around you. Are they always so negative and kind of drawing you down? Or are they building you up? Are they supporting you? Do you have people that you feel like you can rely on?
And you look at the conclusions of a lot of the research. A lot of it will say we found that doing core exercises along with a targeted strength training program was better than strength training alone. Okay, now, you added in another thing and you made it a little more specific to the person and you found it was better, shocker. And with the biopsychosocial model, incorporating aspects of all, areas of the biopsychosocial model are going to help people's low back pain more.
How do I start to address the core? Right? How do I start to incorporate this then into my programming? And that's where we go back to episode 11 of the Optimal Body Podcast. And we talked about the breath. We went over exercises in episode 11 as well that you can use that will incorporate the core, especially when we get into that deep breathing. So just starting there is somewhere that you can go and you start realizing if I pay attention to my breath, I'm doing core exercises as I'm sitting at my desk. I'm doing core exercises as I'm driving in the car, sitting in traffic. Core can mean so many different things, and just starting at the breath, that's an area that I really recommend just starting to address.
Exploring a lot of things is where we need to start. We need to be able to start with all four of those categories of deep core training. And that's kind of, in the Optimal Body program, Jen has these core exercises that go core level 1, 2, 3, and 4. And it kind of goes in this progression of getting slightly more difficult. It helps you start to operate in all planes of motion at our core, which is rotation, extension, flexion, side bending, and how to control through all of that.
Well, it teaches you how to really start from the breath, right? Yeah. And start at that inner core with the pelvic floor. And then how do we progress on there? Because I think a lot of people, when they think initially of core exercises, and this is where it usually turns into back pain immediately, is we go right to the higher level stuff.
I feel like that's a great way to sometimes lose an athlete and then humble an athlete as a trainer or a PT, when you tell them okay, I get that you can do planks with one hand and one foot and all of this different,
or all the weight on your back,
all this weight on your back and all this crazy stuff. I think that might be part of the reason that you're having back pain. And that you tell them that you shouldn't tell them this, but you tell them that they have a weak core in some version of how you deliver that to them or the other. Your core coordination or whatever might be the reason that you're putting too much pressure in a certain area, and they almost get offended. You're saying I have a weak core? No, you're very strong, actually. You just struggle to coordinate that and struggle to have the motor control to understand how to activate all that. I have a degree of that diastasis or diastasis recti of separating, because for so long I was just using the crap out of my rectus abdominis, the six-pack version of the abs, rather than getting into that deep stuff. But it's when you go back to the basic core 1 exercises and focus on that really deep activation, your body starts shaking like you don't know what's going on. That is the case. Your body doesn't really know what's going on. You've never really coordinated your muscles in this way. And it's been like almost a year, 2 years, 3 years of me really working on this stuff, getting to the point where now I'm walking around and I'm finding that I just hold my core in a different way.
Yeah, I mean, that's huge. And humbling yourself enough to say, okay, I'm strong. Like, no one is saying you're not strong if you go back into like, let's look at the fundamentals. It's just that we're going to, like Dom said, coordinate it in a different way. And you'll find that when you dial things back a little bit, or what you feel like is dialing it back, and change your positioning just a little bit, you might lose hip popping. So you might not have hip popping anymore, which we talked a lot about in episode 50 of the Optimal Body podcast. So especially like mountain climbers, bird dogs, stuff like that. If you feel like you're hearing this popping in your hip, well, there's a coordination aspect that's happening there. Just getting back into the fundamentals, you'll notice maybe that you don't turn on those hip flexors quite as much, and you don't feel thigh burning. A lot of people feel thigh burning when we're not coordinating into that deeper layer of that core in that trunk. And again, this is just meaning like I am aware of all levels of my core, and then can use it in stabilization and in movement. And when you can gain that awareness, like you're going to feel so just more confident in any kind of movement or strength training program that you do. Thanks for joining us. Again, I hope you learned a little bit about the core and that you're excited to explore a little bit more. Maybe drop some comments, ask us questions. And if you're ready to start really diving in and exploring what's possible, go into the Optimal Body membership or the Gen platform that we have, because we talk about it so much and we educate just so you can continue to explore. But don't forget to subscribe. We have so many more educational podcasts coming at you.